An important health alert for pregnant women during this pandemic. A new study has found that moms infected with COVID-19 may experience damaged blood vessels and placentas as a result of the infection. So joining me now to discuss this new research and what pregnant women can do to avoid contracting COVID-19, Dr. Chandra Adams with Full Circle Women's Care. Good morning. Thank you so much for joining us.
Good morning.
So I think one of the biggest problems we've had when COVID-19 started was there wasn't many studies to show the impact it had on different people, specifically pregnant women. What are we finding out?
Exactly. So still, the numbers in pregnant women are not huge, but we're able to do a few observational studies, some retrospective studies. A lot of hospitals have adopted universal testing of all women, whether symptomatic or not. And so we're able to find women who previously wouldn't have identified as COVID positive and see what their outcomes are now.
What is your recommendation right now for women who are pregnant? Should they be taking those double extra precautions, or are they, what do you say to them?
Absolutely. Even our local perinatologists are recommending that pregnant women quarantine specifically from weeks 37 on. Everyone is still advised to continue the usual protective measures, wearing masks wherever possible, hand washing frequently, keeping your social distance. But pregnant women are advised to go back into safer at home type orders from 37 weeks until delivery.
Let's talk about this new study out of Northwestern University. How is it telling? Exactly is it telling us?
Sure. So they were able to observe 16 women who tested positive for COVID right around the time of their labor and delivery and examined their placentas after they delivered. And they found that there were some abnormalities in the way that the blood vessels were formed. And it's not really clear what the clinical significance of that was, because all the babies tested negative and still did well. But it is not clear when these women contracted it, whether or not these abnormalities of the placenta may have any implications for providing nutrients or oxygen or blood supply to the fetus.
How hard is this as a doctor or medical professional to not really have many of these studies and kind of go with the time?
It is extremely difficult because women are trusting us to have the answers and to tell them what we know and what they should do in order to have the best outcomes for their babies. And we're just telling them, as the new information as it comes out, still, like, as I said, without a clear picture of what it really means to the pregnancy.
I think it's important to mention, because I know people always think, even I have this insider information that I'm just not telling people or something. And same with you. It's like, well, just tell me what I should be doing. What are you hearing? We're all really learning at the same time.
Exactly. This is a novel virus. And so the ability to be able to study it in real time is one advantage that we have over previous pandemics. Our transmission of information is a lot faster, our ability to disseminate what we're learning. And so every patient that we see helps us learn a little bit more about how to advise women.
So final takeaways for anybody who is pregnant right now, thinking about being pregnant, or has a loved one who is.
So COVID is not an indication for delivery, even though you're hearing that there may be something abnormal about the placenta. If a woman does test positive, it's not an indication for her to come and say, you have to save the baby by getting it out of me right now. Just continue to take your regular standard precautions, and delivery should only be for the reasons that were medically indicated for.
Just keep taking care of yourself and your baby. Dr. Adams, thank you so much.
Thank you for having me.
Vic.